I'm Anwar Parvez. I work in India. I work as a public health specialist since last 10 years. I'm associated with HIV program, and also I have some experience working in TB program, National TB Control Program and National AIDS Control Program as such. In the differentiated service delivery models, we were at a stage where we were planning differentiated service delivery models, especially for ART, in relation to the ART, that is differentiated ART delivery models basically. And we had to come up with new ideas of ART dispensation. So in a project, we tried to work on some models at some of the localities, which are, and for one particular key population groups. And when we were trying to do that, that implementation of or designing the model itself, so during the designing process, the initial first step was we had a literature review for that, and we just went out and saw what is there, which is already being done for a group of people. And we took those learnings and designed our model, and we tried to implement accordingly. But when we did that, even though those were standard models for implementation, but very soon we saw that, okay, so even if it is a standard model as such, it may not work as far as the local requirements go. So needs assessment is an important component for success of any project which you implement as such. So doing the literature review may not be enough. So that is a good start, I would say. So you can see the literature, you can read about, and you can learn about the successes and failures, and what are the stories behind successes of the bigger projects or failures of some of the projects. But if you want to design your own project, then I think for every such project, needs assessment will be a key, because the literature will give you a glimpse of what exactly has to be done to start with. It can be a good start, as I said before, but once you go in the field, so every settings may be different, and the problems you are going to face once you implement a project, so those are the problems you can very well deal with them if you have done a proper needs assessment. So under the needs assessment, you can develop tools for that. You can have some interviews with the population in which you are trying to implement the project, and based on, and you can have some focus group discussions. So there are many tools which can be used to assess the need, and you can do small surveys, and based on the findings of those, you can design and implement a project. So before designing a project, or before taking that to at the stage of implementation, literature review can be one thing, but if the needs assessment, if needs are assessed properly and appropriately, I think it will definitely impact the way the project is implemented, and will definitely contribute to the success of the project. But it should not be a one step process as such. It is of course beneficial in the initial stage of the project, but needs may change over a period of time. So once you are actually into the project, after sometimes you may realize that this is not working, and you will have to do the assessment of the needs again. So it can be included in the middle of the project also, where you again go back and talk to your target audience, and you can again see if the needs have changed, and accordingly you will have to modulate your whole project also sometimes. So doing that before beginning or implementation of the project is helpful, but it can be used in the middle of the project implementation also, and sometimes it helps. And doing those modulations based on the assessments, so that is very helpful sometimes for successful implementation of a project.